The air inside the on-call room always felt a little too warm, like someone had been breathing in it for hours before you arrived. The window didn't open. It had been painted shut years ago, maybe longer. No one really used the room anymore. Most of the new residents preferred the couches in the lounge or the break room with the half-working vending machine. But I came here every chance I got, not because it was comfortable, because it was quiet. The overhead lights flickered sometimes, but not in a haunted way, more like they were just tired. The whole room felt tired, like it was holding its breath. There was a corkboard on the far wall, covered in yellowing notices no one had taken down, paging instructions, emergency codes, the outdated number for hospital security, and in the corner, near the bed, sat an old black pager, boxy, scratched, half buried under a stack of crumpled discharge summaries. It had been there as long as I could remember. My name is Ian. I'm a 29-year-old internal medicine resident, second year. I'm not one of the standouts in our program. I don't save lives with a flourish or diagnose rare diseases from a single symptom. I move through my shifts like someone underwater, carefully, quietly. I try not to miss anything, but sometimes I do. I first noticed the pager lighting up 3 months ago. It was during a long overnight shift, the kind that stretches and folds over itself until you're not sure if it's Tuesday or Thursday. I was lying on the cot, eyes closed, but not sleeping. That kind of half-rest doctors learn to live with. Then I saw it, a faint green glow coming from under the papers, just a single blink. I thought maybe I imagined it. The pager was old, probably dying, and it hadn't been used in years, but the next night it blinked again, this time twice. No sound, no vibration, just that soft, patient light, like it knew I would notice eventually. I picked it up. The screen was scratched, but the numbers were clear. A timestamp, 0241. That was it. No message, just time, and then it turned off. That night at 0241 exactly, I was called to 7 West. A code blue. The patient didn't make it. An older man with end-stage heart failure. I had only met him once, during rounds. He hadn't spoken much, just stared at the ceiling like he saw something the rest of us didn't. I didn't make the connection until the third night. The pager blinked again, 041. This time I checked my watch. I waited. At 041, I got a call. Room 316, a post-op patient, respiratory arrest. She died before the crash cart arrived. After that, I started watching the pager like it was part of my shift. It never made a sound, never demanded attention. It just waited for me to look. And each time, the time it showed matched exactly to when someone died. I told myself it was coincidence, that my brain was tired, that maybe I was subconsciously connecting dots that weren't there. But one night, it blinked earlier than usual. 0109, and this time, there was a name. Thomas D. I stared at it for a long time. I knew that name. He was a patient I had lost early in my first year, a diabetic with a foot infection that turned septic. I'd delayed a consult for too long, told myself he was stable, that he could wait until morning. By the time I checked on him again, he was barely breathing. He coded 15 minutes later. The pager turned off. The next few nights, the pager stayed dark. I thought maybe that was the end of it. Maybe whatever had been happening was over. But then it came back, this time with more names. Eliza Ra Martin, Kai Maya B. Some of them I remembered, others I didn't. But each one, when I looked through my old notes, had died on my shift. Some from conditions I couldn't have changed. Others, maybe I could have, if I'd been faster. If I hadn't been so tired. I stopped sleeping in the on-call room, started using the lounge like everyone else, but even there I felt it, the hum of silence, the pull of the forgotten. My dreams became strange. I'd wake up sweating. The image of that blinking pager burned into my mind. One night I came back. I told myself I needed to face it, that it was just a glitch, just a hallucination, born from guilt and sleeplessness. I sat in the chair beside the cot and waited. At 0337, the pager blinked, but this time, the screen was full. It showed every name, every patient I had ever lost, each with a time, and underneath, in a single line that pulsed like a heartbeat, you were the last face. I dropped it, backed away, but I couldn't stop reading it. That line repeated over and over until the screen dimmed and the pager went black. I don't know what it meant, that I was the last face they saw, that I was the last chance, or maybe just the last witness. Either way, it broke something in me. I stayed up all night, didn't answer my pages, didn't check my phone. I just sat there, trying to remember every face, every name, every time I told a family member. We did everything we could, wondering if I had, wondering if that line on the pager was meant to be an accusation or a confession. When morning came, I left the pager on the windowsill. The sun was just rising, casting long shadows across the floor. I walked out without looking back. I came back that evening. The pager was gone. No one had touched it. The stack of papers hadn't moved. It had vanished like it had never been there. I asked around casually. No one remembered ever seeing a pager in that room. Not the nurses, not the other residents. One of the attendings laughed. Those old things, we phased them out before you started. But I remember the way it glowed, soft and steady. I remember how it never beeped, never buzzed, only blinked like a dying star. I keep my own pager now, even when I'm not on shift, not because I'm waiting for a call, but because I'm afraid of the silence, the deep, unbearable quiet that comes after a code blue. When the machines stop, when the air holds its breath, when the last face is yours. I used to think silence meant peace. Now I know better. There's a strange smell in old hospital rooms. Not infection, not bleach, not even the damp paper of old charts. It's something thinner, emptier, like dust that forgot how to settle. Room 209 has that smell. It clings to your skin. Even when the door's closed, even when the room's empty, it hangs in the hallway like a forgotten breath. Room 209 was tucked at the far end of the west wing, past the oncology ward. Technically, it was in use, but barely. Patients were rarely assigned there. The plumbing acted up, the windows stuck, and the core light sometimes went off without anyone touching it. No one wanted to round there. It felt off. My name is Priya. I'm a 31-year-old third-year resident in internal medicine. I'm efficient, focused. I like things that make sense. Protocols, lab results, evidence. I don't do superstition, and I definitely don't do ghost stories. That's what I told myself anyway before I started rotating through the palliative floor. Room 209 wasn't on my list at first. I didn't notice it until the fourth day of rounds. One of my patients had been transferred there overnight after a roommate conflict. No big deal, the note said stable. I remember walking toward the room that morning and feeling like the hallway got colder by a degree or two. Stupid, right? I even checked the thermostat. Normal. When I opened the door, the light was off, the blinds were closed, and even though it was past 7:30 a.m., the room was dim, as if the daylight itself didn't want to enter. The patient, Mr. Kravitz, was asleep, or at least he wasn't moving. I called his name once, then again. No response. I moved closer. His eyes were open, not just open, wide, staring directly ahead, fixed on the ceiling. His body was still warm. The monitor showed nothing but a flat line. He had died not long before I arrived, maybe minutes. I called the code, went through the motions, but he was gone. Later that afternoon, I reviewed his overnight vitals. Everything had been fine. No signs, no distress. It was like he simply stopped. That night, I stayed later than usual. I passed by 29 on my way to the lounge and heard something, just a shuffle, faint, like someone moving their feet under a sheet. The door was slightly ajar. I glanced inside, empty. The next day, my attending reassigned the room to a new patient, Mrs. Yelena Roth, palliative care, stage 4 breast cancer. Non-verbal, but responsive. She smiled when I spoke to her, nodded when I asked if she was in pain. Her eyes were kind, soft, tired. That night, I had a dream. I was standing in room 209, but everything was reversed. the bed on the wrong wall, the window covered in something black, pulsing. I stood at the foot of the bed, and someone whispered behind me, "Don't turn around." I woke up sweating. The next morning, I returned to 209. Yelena didn't speak, but she wouldn't make eye contact either. She stared at the ceiling, same spot Kravitz had stared at. When I asked if she wanted to change rooms, she shook her head, slowly, deliberately. And then for the first time she spoke. "He sits there," she whispered, "above." I froze. "Who?" She closed her eyes. A tear slipped down her cheek. That afternoon, I asked the charge nurse about room 209. She just laughed and said that room eats light. She didn't elaborate. I tried to convince myself it was just stress, long hours, too much caffeine, too little sleep, but the unease grew. Every patient I saw in that room started to mirror the last. Fixed stares, sudden silences, whispered things that made no sense, and always the same, eyes locked on the ceiling, like something was waiting just out of reach. I checked the ceiling multiple times. Nothing. No mold, no leaks, no loose tiles. But standing beneath it, I always felt like I was being watched, not from above, from inside. Yelena passed away 4 days later. Peacefully, they said, but I was there. I had come in for rounds. She looked at me, held out her hand and whispered, "He's watching now." Then she stopped breathing. After that, I started rounding on 209 last. I'd stall, double-check vitals elsewhere, make unnecessary notes, anything to avoid walking into that room too early. But it didn't help, because soon it wasn't just in the room. I'd be writing notes and hear a soft thud, like someone dropping a chart behind me. I'd turn nothing, or I'd feel a shift in air like someone standing too close. Once, while walking to the elevators, the hallway lights above me flickered in rhythm, left to right, as if something was following my steps. I finally talked to another resident about it, Jonah, calm, no-nonsense guy. He rotated palliative the year before. When I mentioned 209, his face went still. "Yeah," he said quietly, "that room changes people." I asked what he meant. He hesitated. "Patients don't last long in there, but it's not the dying that's strange. It's how they die, always with their eyes open, always looking up." He paused. "I had a patient once. She tried to tell me something, started scribbling on a napkin, over and over, same phrase. I asked what it said. He looked at me, like he was weighing whether I could handle it. He knows your name now." That night, I couldn't sleep. I kept thinking about Yelena, about the way her hand trembled when she reached for me, about the thing above the ceiling she was too scared to name. I went back to the hospital after midnight. I told security I left my badge in the resident workroom. I walked the west wing slowly, quietly. The hallway was dark. Room 209's door was shut, but not locked. Inside, the air was heavier than I remembered. Thick, close. I turned on the light. It didn't help. I looked at the ceiling. Just a ceiling. White tiles. Fluorescent fixtures. Then the monitor next to the bed turned on. No patient was connected. No vitals. Just static. Then a number appeared. 209. And under it, in red. Next, the lights flickered. The door creaked. I ran. I didn't stop until I was outside in the parking lot, gasping like I had just come up from deep underwater. I never reported what happened. Who would I tell? What would I say? The next morning, I found a sticky note on my locker. No handwriting, just the number 209 written in thick red ink. I threw it away. But sometimes, when I walk past certain rooms or catch my reflection in a dark window, I feel it, that pull, that presence. It's not about death, it's about being watched, being marked. I still round on that wing sometimes. I avoid 209 when I can, but I know I'll be called back eventually. They always call you back. The patients know. Some of them whisper about him, the figure in the corner, the shape on the ceiling, the one who watches rounds from the other side. I've started sleeping with the light on. It doesn't help much, because once you see it, once you've stood under that ceiling and felt the weight of his gaze, you realize something terrible. You're not rounding on room 209, it's rounding on you. The cardiology hallway smells cleaner than the rest of the hospital. Almost too clean. like the lemon-scented disinfectant is trying to cover something older, something more permanent. The floors are polished to the point of reflection, and the walls are lined with framed portraits of former department heads, stern black and white faces staring out as though guarding the corridor. I've always hated walking through that wing at night. It's too quiet, too pristine. Like the silence there isn't natural, like it's enforced. My name is Luis. I'm a 33-year-old internal medicine resident. I've done rotations all over the hospital, ICU, palliative, psych, but nothing ever unnerved me the way the cardiology hallway did. I told myself it was just the lighting, too bright, too cold, or the fact that the patient rooms were often empty at night. But there was something else, something I didn't have words for until the first time I met the hall monitor. Not a person, at least not anymore. It started with a routine cross-cover shift. I was responsible for patients on the cardiology service overnight. I'd done it dozens of times before, usually quiet, except for the occasional arrhythmia or chest pain consult. That night, I was reviewing notes in the call room when my pager went off. Room 432, patient agitated. I sighed down the rest of my coffee and headed to the 4th floor. When I stepped off the elevator, the hallway lights buzzed faintly. It was nearly 2 a.m. and the floor was still as a tomb. Nurses' station empty, patient rooms quiet, the kind of silence that has mass, that presses against your skin. I walked toward 432, passing by portraits of doctors long dead. I noticed one frame slightly askew, the glass cracked in one corner. That detail stayed with me, though I didn't know why. The patient in 432, Mr. Delaney, was awake and staring toward the hallway. When I entered, he didn't look at me. He was just there, he said. His voice was raspy but steady. Watching. I asked who. The monitor, he said, then pointed toward the doorway. Don't you see him? I looked. Nothing. I checked his vitals, all normal. His EKG rhythm was steady. I chalked it up to ICU delirium. We'd seen stranger things. I gave him a mild sedative and reassured him before heading back. But when I turned around, halfway back down the hallway, I saw something out of place. There was a man standing under the exit sign, just standing, wearing a long white coat, like an old-school physician. His posture was stiff, his back unnaturally straight, and his arms hung at his sides. He didn't move, didn't speak, just stood there, watching. I froze. "Excuse me?" I called out, my voice echoing too loudly. No response. I blinked, and he was gone. I told myself it was a trick of the light, a reflection. I'd been awake for 20 hours, but when I looked back at the cracked portrait, I noticed something strange. The face of the doctor in the photograph looked like the man I just saw. Same eyes, same angular jaw, and beneath the frame, the plaque read, Dr. Richard Morland, Chief of Cardiology, 1956, 1974. The next morning, I asked one of the older nurses about him. "Dr. Morland?" she said, frowning. "He died here. Massive heart attack, just outside his office. They say he was making his rounds. Never missed a night." She said it like it was trivia, like it was history, but something in her eyes looked guarded. I laughed it off, pretending it didn't bother me. But after that, the sightings became more frequent, always at night, always near the far end of the cardiology hall. Sometimes I'd feel him behind me, footsteps that didn't match mine. Other times patients would mention a tall man in a white coat who came in and didn't speak. He was checking the monitors. One patient whispered, but he didn't have eyes. I started avoiding that end of the hallway when I could, but on call, you don't get to choose where you go. One night, I was called for another agitated patient. Room 440. I knocked softly before entering. The patient, a woman in her 60s, was sitting upright in bed, pale and sweating. "He stood right there," she whispered. He pointed at me, said, "Out of rhythm." I checked her vitals. Her heart was in perfect sinus, but her eyes were wild. "He said my time was up," she muttered. "He said I wasn't compliant." I turned around to assure her she was fine, but then I heard the EKG flatline. I turned back. She had slumped forward, the monitor blaring. We ran a full code, no response. It was like someone had flipped a switch. I couldn't explain it. None of us could. That night, I found myself standing in front of Dr. Morland's portrait. I stared at his frozen expression, and for a split second, I thought I saw his eyes move. I leaned in, studying the plaque again. Someone had scratched something faint into the metal, still rounds. From then on, I noticed small things, changes in the portrait wall, a tie slightly different, a background detail that hadn't been there before, a stethoscope draped differently. It was like the image itself, updated, as if he were still keeping track. I researched him when I had time. Dr. Morland had been a perfectionist, known for firing interns mid-rounds, obsessed with rhythm, order, protocol. He'd write people up for tiny errors. A beat skipped is a life lost, he used to say. They say he died angry. Reviewing a chart he claimed had a dosing error, he collapsed before he could finish writing his notes. Now sometimes I find pages torn out of old clipboards, notes in a careful, archaic script. Room 436, non-compliant, out of rhythm. Room 438, atrial irregularity missed, probable consequence, death. All signed, RM. I've started carrying a rosary in my pocket. I'm not religious, but something about that hallway makes me want to be. I double-check every order. I triple-check medication dosages. My heart skips a beat when the lights flicker overhead, because I know he's still watching, still making rounds, still judging. The other residents joke about the hall monitor. They think it's a funny name, a pun, but I've seen the shadow at the end of the hallway, seen patients seize up at the sight of a man no one else sees. They don't understand. He's not monitoring the hall. He's monitoring hearts. He's waiting for one to fail. And if you don't catch it first, he will. I've considered transferring, switching rotations, anything to get away from that corridor, but part of me can't leave. Part of me thinks he's teaching me something. Not kindness, not medicine, just precision. He doesn't care if you're tired. He doesn't care if the EKG looked normal 10 minutes ago. He just wants you to be perfect, because he was, and if you're not, you'll see him, waiting at the end of the hall. White coat, cold eyes, still rounding. The pediatric wing has a different kind of quiet, not the sterile hush of an ICU or the respectful silence of oncology. No, this silence is heavy with something else, something that feels like a held breath, like the air itself is waiting for the next laugh, the next cry, the next beep of a monitor to remind it that children still exist here. But some nights, the wing forgets how to breathe. My name is Dana. I'm a 29-year-old resident in pediatrics. I got into this specialty because I love kids. Simple as that. I like the way they look at you like you have answers, even when you don't. I like their honesty, their unpredictability. But I also know how fragile they are, how quickly things can turn. My first night on call in the PEDS wing was a slow one. Just a couple of bronchiolitis admissions, a post-op appendectomy, and a kid with a weird rash that turned out to be a laundry detergent allergy. Around midnight, I was finishing progress notes when one of the night nurses, Ray, poked her head into the workroom. "You ever hear the whisper room?" she asked, smiling like she was telling a joke. I blinked at her. "What?" She leaned in. "Room 2117. Baby monitor goes off in there, even when there's no baby." I waited for the punchline. It didn't come. "It's probably faulty wiring or something," she added quickly. "But the sound, it's not just static. It's like something breathing through it." I laughed a little, but she didn't. "Don't worry, nobody puts patients in there anymore," she said. "We try not to." I didn't ask more questions. I figured every wing has its folklore, some creepy story to pass the time during night shift, but I couldn't stop thinking about it. Around 2 a.m., I was walking past 2117 on my way to check a fever spike in 224. The hallway was empty, lights dimmed to that soft bluish tone meant to mimic moonlight. When I passed 2117, I heard it. White noise, faint, just loud enough to be noticed if you were listening for it. The kind of sound a baby monitor makes when the crib is empty. I stopped. The door was cracked open just slightly. Inside, darkness. But the sound was definitely coming from there. I pushed the door open a little more. The sound grew louder. It wasn't just static. There was something under the static. A rhythm, a soft, labored inhale, and then an exhale, over and over, like someone was sleeping or trying to. I backed away. Goosebumps prickled up my arms. I shut the door gently and walked on. Later, I asked Ray again, what happened in that room? She didn't answer right away, just shrugged. There was a baby once, preemie, long time ago, back when we didn't know how to handle infections like we do now. He died in there during a night shift. They said the monitor never turned off. They had to unplug it. Even then, sometimes it would beep randomly. She rubbed her arms. Some nights we still hear it, the breathing, like he's still trying. I nodded and said nothing. 2 nights later, I had a patient transferred to 2116, right next door to the whisper room. 4-year-old girl named Amina, febrile seizures, nothing too complicated. She was sweet, quiet, clutched a stuffed bear like it was oxygen. Around 1:30 a.m., her mother came out into the hall, eyes wide. Someone was whispering through the wall, she said, right next to Amina's bed. I checked everything. No one was in 2117. Door locked. I even opened it just to prove it to myself. Silence. I reassured her, told her maybe it was someone passing by the hallway. She nodded, but I could see she didn't believe me. The next night, same thing, but this time, Amina was the one who told me. He was crying, she whispered, but not loud, like this. She breathed in and out through her mouth, barely audible, like he couldn't find his mama. That night, I sat outside 217 on a folding chair during my break. I brought a cup of coffee and a notepad, thinking maybe I'd write up discharge summaries. I didn't get far, because the breathing started again, faint, slow, inhale, exhale, inhale, then something else, a crackle of static, and under it, so soft I almost missed it, a whimper. I stood up, pressed my ear to the door, more static, then, I backed away. I didn't sleep that night. The next morning, I asked to review the chart from the baby Ray mentioned. The preemie, the file was old, scanned from paper. Baby boy Carter, born at 28 weeks, severe respiratory distress, multiple rounds of surfactant therapy. He coded 3 times. On the final night, the nurse noted, monitor continues to register shallow respirations, despite asystole. Unplugged, no response, room cleared. Under cause of death, someone had written, respiratory failure. Then someone else had added in pen, and abandonment. I read that line 5 times. I didn't tell anyone. Over the next week, the static came and went, always around the same hour, between 2 and 3 a.m., like clockwork. I tried to rationalize it. Maybe there was an old speaker left in the wall. Maybe it was feedback from a pager or someone's cell. But then Amina started having night terrors, not seizures, just waking up screaming. He's cold, she sobbed one night. He's so cold. Her mother wanted a room change. I approved it without question. After she left, I stood in room 2116 alone for a moment, listened, nothing. Then faintly, through the adjoining wall, help. That was the last night I ever sat outside 2117. A few weeks later, they closed the room permanently. New administrator said it was due to facility upgrades, but we all knew better. They sealed it with tape, disconnected the power, put a storage sign on the door. But sometimes, only sometimes, I still hear the static as I pass by, like something still plugged in behind the wall, like someone still trying to breathe. I try to remind myself it's just feedback, a mechanical glitch, an echo of a monitor that was never properly decommissioned, but I don't believe it, because I remember the voice, the whisper, the way it shaped a word it shouldn't have known, a word no baby should have to say while dying, ma, ma. The sound lingers in my head sometimes when I'm washing my hands in the encore room or when I'm adjusting the volume on a perfectly working monitor. It's not fear exactly, it's sorrow, like something unfinished, still trying to finish itself. We think of ghosts as angry, violent, vengeful, but I think the worst ones are the ones who just want to be held again, the ones who never had the chance, and who somehow refuse to stop asking for it, even through white noise. It's funny how quickly you forget the names. Not out of carelessness, there are just too many. Faces, diagnoses, discharge notes. It all becomes paperwork eventually. You spend enough time on the wards, and it feels like your memory develops calluses. I used to keep a little notebook of the patients I wanted to remember. Their birthdays, what they liked in their coffee, who had family that never showed up. But I stopped. The list got too long, and I started dreaming about them. Now I just write the summaries and move on. I'm Dr. A.J. Sharma, 32 years old, third-year resident in internal medicine. I finished my final year this fall, and I'm already counting down the shifts. I used to love this work, felt like I was making a difference. Now I'm just tired. Everything I do feels like maintenance. Keep the heart beating, the lungs inflating, the kidneys filtering. Most of the time that's enough, but sometimes it isn't. It was a Friday, a long one. I had 3 new admissions in the morning, 2 discharges by lunch, and an ICU downgrade around 4. By the time I made it to the charting room, I was running on caffeine and saltine crackers. I started going through the backlog of discharge summaries I hadn't finished. Most were straightforward. Unremarkable courses, stable vitals, adequate follow-up. Then I opened a file I didn't recognize. The patient's name at the top of the page, Nadia Cross. I paused. I didn't remember admitting her. Her chart was thin, no imaging, no labs, just a brief admission note from 3 days ago. The handwriting was odd, slanted, too neat, not typed, written in ink. Patient presented to General Medicine Ward 5B. Symptoms include persistent fatigue, inability to rest, memory disturbances, whispering heard at night. No known medications, no family contact. There was no resident name, no attending signature, just that note. I thought maybe it was a psych hold that got misfiled. I tried searching the EMR for her room number. Nothing came up. I clicked into her vitals tab. There were none. Just a single sentence, vitals unavailable. I stared at the screen. This wasn't a real chart. It couldn't be. Some kind of corrupted file, or a leftover training template. That happened sometimes. Skeleton files from simulated patients getting mixed into real accounts. But then the cursor started blinking on the summary line, and I swear I didn't touch the keyboard. The template opened on its own. Discharge summary, Nadia Cross, date, blank prepared by Dr. Ajay Sharma. I froze. There was no way. I hadn't typed anything. I hadn't even touched her chart before that moment. I looked behind me. The charting room was empty. The hallway outside was quiet. It was just after 2 a.m., the kind of hour when even the monitors seemed to breathe slower. I stared back at the screen. My hands started typing before I gave them permission. Patient remained on service for 3 nights. No visitors, no significant interventions. She spoke rarely. When she did, she only asked one question: "Will you remember me?" I deleted the sentence. My hands were shaking. I shut the screen, logged out, and left the room. I told myself I was overtired, sleep deprived. I'd been on 12 days straight, barely 5 hours a night. I probably opened a ghost file, some old note that hadn't been purged from the system. It didn't explain the typing, but I refused to think about that part. The next day, I came in early to check the system logs. There was no record of a Nadia Cross, no admission, no discharge, no order entry, no note signed by me or anyone else. I asked IT to check deleted files. Nothing came up. Still, when I sat down to chart that afternoon, her name popped up again in my incomplete summaries. Awaiting discharge, Nadia Cross. I clicked the file. This time, it was different. There was a photo, a grainy ID badge image, slightly off-center. A woman in her 30s, pale, tired eyes, long hair tucked behind her ears. The kind of face you could forget unless you really tried not to. Beneath it, more text had appeared. Still here, still waiting. I slammed the laptop shut. I didn't go back to the charting room that day, but I kept seeing her name. On whiteboards, on clipboards that were supposed to be blank. Once written in dry erase marker on the door to a supply closet. Room 5B, Cross, N, awaiting final note. That room hasn't been used in over a year. It was closed after a patient coded and couldn't be revived. A clerical error had kept the door unlocked, and a homeless man wandered in one night, thinking it was an empty bed. He died in his sleep. They shut the room down after that. I checked it anyway. Late at night, just before sign out, the lights were dim, the bed was made, the walls still had faded stickers from when it used to be a pediatrics overflow. There was a file sitting on the table, just a plain manila folder. Inside, one piece of paper, discharge summary, Nadia Cross. The same format, the same neat handwriting. Patient lingered for 3 nights. No medical intervention altered her course. Her final question, if no one writes it down, was I ever really here? I left the room. I didn't go back, but every few nights, I still get the alert on the EMR. Incomplete discharge summary, Nadia Cross. I tried reporting it. It couldn't find a bug. Admin said I might be accessing a training server accidentally. I wasn't. The nurses have started asking questions. They say they've seen her name on patient lists, but when they go to prep the room, it's empty. Once a float nurse swore she helped settle her in bed, said the woman was soft-spoken, polite, looked tired, but when she came back with medications, the bed was empty, sheets untouched. I tried writing the summary. I really did, just to end it. I filled in all the fields. Diagnosis, unknown. Treatment, none. Outcome, undocumented. But when I clicked submit, the screen went black. Then one line appeared in white font. You cannot discharge what you never admitted. I don't know who she was, or is, but I think she's looking for acknowledgement, for someone to finish her story, to finalize her paperwork and say, you were here, you mattered, you left. Hospitals don't do well with things that linger. We are a system of beginnings and ends, births and deaths, intakes and discharges. We don't have forms for what stays behind, but she's here, and until someone finishes her note, I think she always will be. I don't use that charting room anymore, but sometimes when I pass by, I hear typing, soft, rhythmic, like someone trying to put themselves into the record, one keystroke at a time.